Hello, this is Anita Brummett with the Working Well and Coppell Committee of the Coppell Chamber of Commerce. I'm here today with Dr. Toya Dudley of Compassion Smiles Dentistry. Thanks for being here, Dr. Dudley.
Yes, thank you. I appreciate the invitation and being able to join in today.
Absolutely. So I've got a question for Dr. Dudley about some of the things that are going on right now, and I am just going to dive right in. So first, Dr. Dudley, it seems like all of our normal routines are kind of out of whack. So what can we be doing at home to keep our teeth and gums healthy right now?
Okay, what's really important currently at this time is the maintain of brushing at least twice a day, morning and night, and to also use a soft bristle toothbrush. A lot of times, many of us think that using a medium or hard bristle toothbrush, it's actually cleaning the teeth, but actually, in actuality, it causes more damage and can cause the teeth to be more prone to becoming sensitive when you're eating or drinking something hot or cold. So you always want to use a soft bristle toothbrush or extra soft bristle toothbrush. Brushing twice a day, that's adults and children of all ages, morning and at night. And then also too, if you have braces, I would even encourage you to even brush more than at least twice a day, at least even like at lunchtime as well, 3 times a day or a little bit more, because the food particles can get caught in those braces a little bit more easier compared to if you don't have braces. Along with that, maintain the routine too. I know a lot of times we kind of forget with flossing, but flossing once a day is extremely important. It does help a lot. It maintains your gums to become healthy and not really puffy and having that inflammation. It decreases chances of that occurring, along with helping decrease cavities from occurring on the sides of your teeth. So maintaining that daily routine of brushing your teeth twice a day and then flossing at least once a day. There's also many electric toothbrushes that are great on the market that you can use that also mimic that proper toothbrushing motion. Always want to brush in circles if you're using a manual toothbrush, but if you're using electric toothbrush, it does have those proper toothbrushing techniques. There's different toothbrushes on the market. There's the Genius toothbrush by Crest Oral-B. It's a great toothbrush. It alerts you like if you're brushing too hard, or if you need to slow down, or even areas that can actually connects to your phone where it will let you know any areas where you need to spend more time in brushing. And we actually will be having that in our office really soon here at a reduced rate, the Genius Oral-B by Crest Oral-B toothbrush. There's also the Sonic Care as well. Those are really great toothbrushes too.
Okay. So what I'm hearing is, despite our routines being out of whack, we still have to do all the other dental care that you want us to do normally.
Yes, want to currently continue doing that. And then also too, a lot of times when we are, when we have been at home for quite some time, we tend to have probably done a lot of snacking and eating different foods and things. So just being mindful of kind of working on, eating things that are more on a healthier side. Those snacks that tend to be a little bit more high in sugar, like the fruit snacks, especially with kids, they get stuck in the pits and grooves of the teeth and can set up, if those areas aren't clean really good, it can set up for cavities to occur. So just kind of looking at healthy alternatives when you are snacking, like fruits, nuts, fruits like apples, strawberries, blueberries, for example, nuts, or even like a smoothie, for example, there too. So that's really important.
Okay, that's really important. Thank you. So when it comes to dental care, there's the dental offices shut down, now they're reopened. We understand that it's been safe to get emergency dental care all along, but is it safe to get routine dental care right now? Because a lot of people have the time and they're not necessarily at work. And if it is safe, what is Compassion Smiles doing in particular to protect your employees and your patients?
Okay. Well, yes, definitely is very safe right now to do routine dental care. And also, especially if you have emergencies. Most dental offices, including our office, we are open back up. We're seeing everyone. Things that we are doing differently to keep you and your family safe is that we have made some changes in our office. Things that we are doing is for one, is when patients do come to see us, we're asking you to stay in your vehicle, give us a call, and then once you arrive, we'll have you come on in. You'll also notice too, when you do walk into our office, we have some things that are set up that are different than compared before COVID-19, such as now we have what's called I call them the sneeze guards. You may have seen those when you go to the grocery store and even at the bank. Those are in the check-in area. You'll see those. You'll also notice too, our waiting room is closed. And so we have removed all magazines, all toys. We also have a beverage bar, which generally we serve like coffee and water. However, that's closed as well, but we do still offer water and coffee. Just ask us and we'll get that for you. And then as you walk through our office too, you'll notice that you'll notice our staff too, our team, our dental team. We have been always in the past with dentistry. We wear our personal protective equipment. And in the past, we've worn that, which has just traditionally been the mask, the eyewear, and gloves. But now, in addition to that, you're seeing that what we're going to be wearing is face shields. You'll also see that we will have on long gowns as well. You'll see our front desk person will have on a mask. So those are things that we're doing too. Along with that, when you do come to our office, we do have air purifiers in our treatment rooms. Those are turned on and kept constantly on for patients. Along with that too, we're asking when all patients do come in we're taking your temperature. And if you have someone that comes with you, we're limiting the number of people that can be in the office. So what you'll notice when you come to your appointment, it's staggered. The appointments are staggered. You'll find yourself being the only patient in the office at your appointment time. And so when you do come in, we ask that if it's just you have an appointment, that you just come alone. However, some adults may need additional assistance, so you can bring one companion. If it's a child that needs an appointment, they can bring a parent or guardian. And we'll also be having taken their temperatures as well. We'll also ask a few questions related to COVID-19, the screening questions. So those are the things that you will see that we are doing differently. And of course, when it comes to sterilization, we're following, like we did before, the standards and protocols by the Center for Disease Control. If you have any additional questions regarding of how we are doing to keep you safe too, along with that, that's going to be on our website at www.compassionsmiles.com. So yes, if you're having any tooth pain, we want to see you. Definitely. And then also if you're experiencing like an aching tooth, or if you're experiencing any jaw pain, like for example, you may be grinding your teeth, and a lot of times during COVID-19, things could be stressful because a lot of changes we've had so far. And one of the signs of stress is grinding your teeth or clenching down. If you're having that pain when you're waking up in the morning, we want to see what's going on, because it could be that you may need possibly a night guard. If you're having any pain that is like any teeth that are when you're chewing your food, or any swellings with your gums, we want to take a look and see what's going on.
Okay, that's really helpful. So something I've heard from a lot of practices is that patients are waiting until they're really sick to come in. And so by the time they land in your office, it's actually worse than it could have been. And so I just wanted to see if you have any advice for patients on that.
Yes, early detection is really key. Early detection prevention. It's definitely, if you if you know that it's been a while that you've been to the dentist, and you know that it's been, like, for example, if it's been past 6 months, we want to see you. We want to have you come in, do a checkup, so we can see exactly what's going on, and just to make sure everything's okay. Because if it's something that's really small, like a small little cavity, we can treat that with a filling. But if you wait until you start to feel those symptoms of having the aching pain that's waking you up at night, or pain when you're chewing your food, or pain when you're eating something hot or cold, at that point, it could be a possibility that it could be bigger, that cavity, where you may need more than just a filling. So definitely want to encourage you, to definitely keep up with your routine checkups. Early detection, prevention's key. Things we could do preventative. We could even place sealants on teeth that may be prone to, if they are prone to getting cavities, we can be able to do some preventive things there with sealants and fluoride.
Okay, fantastic. So just to recap, what I'm hearing is we need to keep up with our routine dental care, that it is absolutely safe to come in to see the dentist, and so we need to do our twice a year visits. And that if we're having any teeth pain or grinding or anything like that, don't wait. Go ahead and come in now, get it taken care of. And that Compassion Smiles already had a lot of processes in place to keep people safe, and you're doing even more now to make it even safer for patients.
Yes.
Okay. Well, Dr. Dudley, thank you so much for your time. Thank you for being there for the community of Coppell, and we really appreciate you.
Yes, we appreciate everyone as well. The support has been really amazing, and we really enjoy being here and just serving and just helping out in the community as much as possible.